distance, then we'll all be hale and hearty. If you love them enough.
Okay, hi everyone. I hope you enjoyed our little jingle that we shared. So we had received that little COVID jingle about precautionaries, wearing masks, staying outside. And let's see, Donna Anna Wellness Institute, they had worked collaboratively to kind of create the jingle and share the jingle and disseminate it with the community. So I'm not sure if anyone from Donna Anya is on here, but we love it. So we wanted to share it and kind of have it running while people were coming in. So today, thank you for coming to our Health Councils Talk for January. We're so excited to always have presenters and speakers come monthly. The idea for the Health Councils Talk is to just kind of share resources, share networks, and then, always, see how we can always engage with community, but also, provide more services and, just educate one another and share, just share information. So today we're going to have two presenters, and our first presenter, and let's see if she's here. So Mary Feldbaum, and I believe I seen her log in. So she is here to talk about a campaign. And she is from the Health Security for New Mexico's campaign. So she's the executive director. So she'll be kind of starting us out for the Health Councils Talk. She'll be starting us out with the Health Councils Talk and then sharing her presentation. And then we can also go into questions. And then we have a second presenter today. And she is from Constellation Consulting. So her name is Krista Martinez. And I'll share a little bit more about her once she logs on. So Mary, are you all set to present?
I definitely am to this esteemed group. It's very exciting to be here. I know some of your names, and I know some of you are familiar with the health security plan. We're the largest coalition in the history of our state, 170 plus organizations that have been, many of whom have been working for years on us setting up our own health plan. And there are so many advantages to doing that. And essentially most New Mexicans would be automatically covered. The tribes as sovereign nations could decide how they want to participate or if they want to participate. And there would be freedom of choice of doctor and hospital, including across state lines. Services would start off no less than what state employees have. So if any of you know those services, they're quite good with behavioral health and acupuncture and other important services that are needed. And it would be administered, if you think about a co-op, by a geographically representative citizens board. Many of you from outside of Albuquerque and Santa Fe, and the board is designed so that you're in the majority of this board, not Albuquerque and Santa Fe. And it's people who are on the board have to be recipients of the plan. And it's just like any public entity with open meetings. They can't behind our backs say, oh, we're going to cut services. It's our plan, and our money will actually, our premiums will go into a dedicated fund, and we're talking billions of dollars. At 1%, we'll actually be able to create a reserve fund to help with something like a COVID, but it will also allow for investment in rural areas and the much needed services that are in rural areas. And last session in 2021, the two big sponsors of our bill decided to, instead of introducing the bill, let's start off with let's start designing it. And when you design it, and the design process will take several years, you're actually going to come up with a cost analysis that is much more accurate than what think tanks have done in the past. You're making projections. I have a neuropathic cough, so sorry. It is not, fortunately, it's not COVID. And so essentially there, while the Health Security Act has a lot of great ideas in it, for example, you may have rural hospitals that are slightly in financial trouble. And there is an approach called global budgets where a hospital receives a guaranteed revenue stream. And it's done in Europe, it's done in Canada, it's done in Japan. And what's exciting about it is Maryland got funding from the Center for Medicare and Medicaid Services. There's it's an innovation funding project of CMS, and they've been doing a global budget system for about 4 or 5 years, and it's very successful. Pennsylvania got so excited, they started to do it. And we think that it's a natural for our hospitals to do it. It's in the health security plan. And so it's one of the research topics that the superintendent of insurance selected. The money that was collected last year went to the superintendent of insurance to supervise the design process. And so the Global Budgets Project is one that he selected. Another one is we're having a problem with health professional supplies. I can't tell you how many providers are so frustrated with our current system, with the billing requirements. We had a panel recently, and you can go on our website and listen to 5 different professionals. And what they say are the hassles they have to go through, not only in order to be paid, but which interfere with patient practice, patient care. We're seeing some physicians are retiring early, some are leaving the state. And even if they're in practice, they're frustrated and hassled. There's no way for you to see a patient when you're in need. It is a serious problem. So the superintendent of insurance selected that issue as a major issue. And the first is to look at provider payment systems. And he's hired some consultants to do that. He's going to be having reports, and they're going to be public, but this is initial research. And the idea is that let's figure out what's out there, what's possible. The superintendent wants to know how global budgets work in Europe. I mean, how fascinating. May not be appropriate for our state, but it should certainly stimulate us. We'll want to know about Maryland. And we'll want to know about different payment systems that are used. There's something called an all-payer payment system that completely alleviates this complicated system we have in the United States. And even that's going to be explored. So the idea is let's see what the lay of the land is. And in a public process with public discussions, let's say, gee, I don't like that. I don't think that would work here. Oh, this is stimulating, but we could do it this way, So the idea is to come up with our own plan, smothered in green and red chili, and learn from what's going on. And so that's the purpose of the design process. There are lots of issues that have to be dealt with, such as bulk purchasing of drugs, which was not one of the things that was selected. How about what's called interoperational IT systems? So that if you go to a doctor and you actually have a different insurance plan, that physician would be able to know your records. That's very critical in emergency room. We don't have that kind of system. In Europe, they do. You go to a doctor or a hospital, they'll know what drugs you're on, about your history. United States, we don't. And so it's called an interoperational IT system that many providers really would love. And then the coding systems that are used. We have the most complicated coding system in the world. It is so frustrating. I just heard from a psychologist that said a child that has a specific mental health diagnosis is coded the same as an adult. That's this treatment will be different. And so we have an opportunity now to continue this process. So what we're doing this session is requesting the legislature to continue funding the health security plan design process under the auspices of the superintendent. And what is happening, I think some of you are aware of the budget, is there is junior money, and that's what we got last year. The chances of us getting, we really need, as Senator Liz Stefanik said, now is the time to really invest in this, in design ideas. And the request by the Health and Human Services Committee, and endorsed it, is 1.5 million. That is not going to be added realistically into the budget. Our House Bill 2 is a supplement. But with junior, which is a supplement to House Bill 2, it can. And for those of you who may not know what junior is, the surplus monies, there's an allocation to each legislator of a certain amount of funds that they can donate to programs of their choice. And in the House, it's each legislator gets $360,000 to play with. And in the Senate, it's $600,000. And they have to be in $50,000 increments. So you can't donate $10,000 to an organization. So we are asking legislators, and if you think this is important, it is critical that you ask legislators to donate $50,000, and there's specific language that in a request that has to be made. And we can send you that language that was agreed to by Representative Diane Hockman-Vigil, who is our chief sponsor in the House, and Senator Ortiz-Pino in the Senate. There's a very specific language in order so that it's not thrown out, because if you don't do it right, you're not going to get the money. And all of you need to be aware, if you are counting on junior funds, that I just heard that a deadline for the House is Tuesday at 5 and Monday for the Senate at 5 to submit requests. The response I'm getting is that's insane. That's really, really insane. And I would assume that some legislators are going to complain, because we all just found out about this, and how can you just organize this and let, your constituents know about this so that they can ask, for some junior requests. So that's what we're trying to do. We are the first state in the United States to actually roll up our sleeves and say, how are we going to do this? And what's so exciting is when I use the term smothered in green and red chili, I really mean it. All of us can come up with something that is can really work for our state. So no one would ever go bankrupt over healthcare. It would be automatically covered. And we're going to do it slowly and carefully. And many of the subjects, like bulk purchasing of drugs or global budgets for hospitals, can be done here and now. There's no reason why you have to wait 3 or 4 years. You can start developing those programs now, because we are in an emergency situation. And the discussions we've had with providers is they're very excited to finally see that there's someone listening to their concerns, and we want to figure out a simpler, easier system for both providers and patients. No friends of mine in France or Spain, even Colombia, are just shocked at our complicated system, which costs a ton of money. It's wasteful money. It's not just the insurance companies, it's the middle people. It's also that providers have to hire consultants to help with coding. They hire consultants to help with negotiating the myriad of fees for the same procedure. With insurance plan A, B, C, D. I mean, it is utterly insane. And I urge you to go to our website, because you can get a lot of great information about what we're doing and thinking about alternatives that we all want to have input into. So I'm going to stop, and hopefully you have a lot of questions.
Thank you, Mary. And I at one point I did see Rufus's hand raised, so I just wanted to check in with you, Rufus, if you had a question or a comment.
No, that was an accident. Thank you.
Okay, thank you.
I was trying to figure everything out. Well, thank you.
Okay. All right. Any questions or any comments from?
Yes. Yes, this is Bob Dryja. This is Mary, could you send out or put on the chat list your email address? I just was scurrying through it, trying to see if I can find a connection for you, and I don't see it.
Okay.
It may
I
be
put-
hid among the 35 listed. Thank you.
I'll put it in right away, but my email address, and I put in our website.
Oh, that's also good.
Yeah, which really has a lot of information. But I am extraordinarily concerned, and if any of you are hoping for junior monies, you need to know how fast they're trying to push this through. That's not right, I don't think. We are, we think that it's so important, we've got to solve problems here and now with healthcare. We're in crisis. We've got to do things. There are lots of interesting programs and proposals, but we also have to think big and systemically, because the way we're providing healthcare is so costly and so complex. And so even if we have it's like a balloon, we have a program, it's going to pop up somewhere else, the significance. And so it's really, we urge you, that to talk to your legislators about adding $50,000 to the health security plan. And in the chat, I will also put that language, that's required by the sponsors, so that the $50,000 will go to the superintendent of insurance to do what we want it to do. And I have to stress, it has to be public. Our campaign is insistent on public process, public transparency, public input into the design of this. And that's going to be critical to our success. And for once, New Mexico could be number one in doing something like this. So.
Okay, Mary, we have two with maybe questions. We'll go with Marilyn, and then we'll go with Holly.
Yeah, you just referred to it again, and you're speaking about a particular language that has to be used when you're making a request. Is that just for your request, or is that for all junior monies requests?
Holly, it would be for all junior money requests. For instance, if you referred to a bill, an act, to fund an act, the junior monies would go to fund an act that you're hoping would pass. It won't, and if the bill doesn't pass, you've lost your money. So you want to be very careful with, and the legislator you're going to should be aware of what is needed if you want something for behavioral health, let's say, or that's why. So I'll give you I'll send you in the chat the language that Representative Hockman Vigil and Senator Ortiz-Pino want legislators to write into their request. And you need to know that half the allocation, like the House's, I said was 360,000, half of that can go to non-recurring programs, funding for for programs that have non-recurring funds. So half go to those that are in existence, that have already been authorized and are recurring. And it's the same for the Senate, same requirement, but they have to be in $50,000 increments. That's what you need to know. Mm-hmm. Does that answer your question, Holly?
Marilyn. Yes, okay. Thank you, Marilyn. And Holly?
Yeah, I just wanted to mention, Mary, it's good to see you.
Oh, okay.
I just wanted to thank you for your years of dedication and effort to this project. It's been going on for years, and you just have an amazing amount of energy and knowledge around it. And so I really appreciate all the work you've done for years on this.
Oh, thank you, Holly. There is so many wonderful people around the state. I just am very excited about, we've traveled to rural areas a lot. And we think it is so critical for rural areas to have serious input into this, as well as the tribe. Met so many smart people, all kinds of types that I think we're going to come up with something very exciting and creative. And the other thing to think about is, there are a lot of issues, for instance, enrollment. How are people going to be enrolled? What's the appeals process going to be like? Because if we don't like a decision, how is that going to happen? What's the checks and balances? And how is all this money that's now going to go into a pot for us, like a co-op, how is it going to be invested? And, that's a whole issue that we're going to have to think about. That's not in the Health Security Act, but eventually is going to have to be talked about. And accountability issues. So aside from just, how we're going to get healthcare go.
Mary, so did Mary freeze?
You did for me.
Okay. Oh no, well, I hope we get her back on. Yeah, she looks like her screen is completely frozen. So if there are any other further questions or maybe comments, we can post them in the chat. And if she comes back on, we can always relay them to her, but also I can always connect with her and give her those questions, when I can contact her at a later time. So let's see. And so I guess with Mary freezing here, I think we can go to our next presenter. And so our next presenter today is going to be Krista Martinez. So she is with the Constellation Consulting, and her goal is to work with the Alliance of Health Councils and provide training that ties tobacco and nicotine use to other chronic illnesses. So Krista, if you are all set, we are ready for you.
Wonderful. Thank you so much. I'm going to share my screen because I've got a presentation for you. Before I actually get into the presentation, I see a number of familiar faces, but I specifically want to thank Sharon Farinelli and Geraldine for the partnership and the opportunity to present to you today. I've worked with Sharon on not just this particular effort, but she and I are also on the Presbyterian Accountable Health Community. So it's a small world. It's definitely a small world. So thank you for that. And I see a number of other familiar faces as well. So it's just great to see everyone. So I'm Krista Martinez. I'm with Constellation Consulting. Constellation is a contractor with the New Mexico Department of Health. And the work that I'm doing this year is around nicotine treatment and cessation practices, working with health councils, working with behavioral health specialists, working with community health workers. And then in central New Mexico this year, we're specifically working with nonprofit organizations tied to food insecurity and domestic violence. So there's a couple of buckets that I'm working under. So some of you, I'm working with you in other areas. So I just kind of wanted to give a quick background of the work that Constellation is doing this year in partnership with the New Mexico Department of Health. So this presentation, before I get started, I want to acknowledge that this was created by the New Mexico Department of Health and the TUPAC organization. So TUPAC is Tobacco Use, Prevention, and Control. They are right in the middle of a name change. So instead of TUPAC, they are transitioning to NUPAC. So you'll hear me refer to, on the slides, you're going to see TUPAC, but you will hear me say NUPAC. same organization, same efforts. And as we get into the slides, I'll talk a little bit more about that. I'm going to breeze through some of the slides a little quicker than others. I will also be shifting my screen so you can see some different web pages. So bear with me as we navigate the Zoom. And I'm going to actually turn my video off as my camera is right in the middle of two computer screens. So I'm never looking in the camera unless I'm talking directly. Now I just think it's weird. So I'm going to do that and then get started. Stop video. Okay, great. Okay, so with that, just going to slide that bad boy over. And just let's get into this. So going over NUPAC's mission, it's to improve lives by eliminating the harm from tobacco use and nicotine addiction using an anti-oppression framework and effective strategies that reach, involve, and mobilize individuals, organizations, and communities to develop policies, systems, and environmental norms that support nicotine-free lives. So really, this presentation is the reach portion of what we're doing. So we'll be doing some reach and involve in this work and in this effort. Some CDC best practices. NUPAC is the statewide organization. So the CDC best practice, and it's pretty extensive if you go to the CDC website and take a look at the tobacco control programs. But specifically, the efforts are to prevent initiation of tobacco use, promote cessation and assist tobacco users to quit, and establish smoke-free policies and social norms. So that's really the big picture of this effort. Now, with respect to TUPAC goals, there are 4 goals that are tied to their efforts to reduce disease, disability, and death related to nicotine use. Constellation in the work that we're specifically doing is identifying and eliminating nicotine-related disparities among population groups. 1, 2, and 3 roll up into number 4. All of that ties together. And I just want to acknowledge down at the bottom this specific piece, the NUPAC program, and I'm just still not used to going to NUPAC, so you're going to hear me go do both. The NUPAC program acknowledges the traditional and beneficial use of tobacco within many Native American communities. NUPAC supports activities that address the harmful and addictive use of tobacco products outside of its use in traditional practices. So that's really important to NUPAC, to especially here in New Mexico, working with with the 22 tribes across the state, just understanding that cultural relevance and those pieces. So NUPAC today, this is the statewide control program. I'm not going to go through every single piece, but I'm going to just talk a little bit about the comprehensive team. So NUPAC is part of the Department of Health. Constellation falls under the 10 statewide contractors. So there are other contractors that are working on different pieces of nicotine use and prevention. And so as we go through the presentation, depending on what your health council needs, I can connect. Our goal is the connections and collaborations. So we do a lot of that work. And making sure that you have the materials and different things that you need. Okay, so I just want to spend some time going over the campaigns and resources. And so I've sent out a number of emails and many of you have responded wanting to work with me to develop your own action plan for your health council, recognizing that every single health council has different priorities, different needs. And my goal with working with the health councils is not to add more to your plate. It's just to integrate additional resources and make them available to you. So one of those pieces is not adding more work to the amazing work that you're already doing. So that's really my goal as I'm working with various health councils on that. So going into the resources. So at the top, you see here the individual for the individual. Many of you are probably aware of the Quit Now resources. That is designed for the individual for cessation to support quitting. There's online training for health professionals available. And these are all links, and Geraldine has this presentation with the links, and then I can also make all of this is available on the NUPAC website. And then health systems change, the training and outreach program. So that's some of the work that Constellation is doing in partnership with NUPAC and other organizations. I'm seeing, okay, and this next slide. We talk a lot about the environmental approaches that encourage and reinforce tobacco-free lifestyles and behaviors. These specifically are tied to youth. If we can get the youth into a place that they recognize a tobacco-free lifestyle and behaviors is beneficial to them, and there's ways that we do that: youth engagement and advocacy, policy development, and these are all different links, but I'm going to specifically just quickly take a look at one. I think I have to do a stop share. Well, let's see. Let's just see how it works. I'm going to slide a page over. Are you seeing the website that I slid over? Or are you seeing the presentation?
Still the presentation.
Still the presentation. Okay, so I'm going to just do a stop share real quick and then a share again. That's the one thing I have a love-hate with Zoom, but you know, there's worse things. So one of the resources is this ride tobacco. So, you know, recognizing in different parts of the state, just different ways to reach young people. And in what I was looking at when I was talking with my team at NUPAC, you know, they specifically highlighted, you know, this particular effort, and you know, recognizing that rodeo is part of community in different parts of the state, and tobacco oftentimes is heavily linked, especially chewing tobacco. And so this is the tobacco-free rodeo piece. So just one link that I just wanted to share with you. I'm going to go back to the presentation. Okay. So, you know, looking at no minor sale, tobacco-free campuses, and not just at the college level, but at the high school level. And I'll talk about that in a little bit. Okay, I'm going to stop my share again. I think this is the worst slide on this deck. So, because you can't really see anything. So we're going to take a look at the actual website for NUPAC 2PAC. And you'll see here, is the website showing up? Okay, good. I'm seeing some nods. Perfect. Thank you. So this is the NUPAC website, and there are a ton of resources in here. I just wanted to show this to you just because that graphic is really difficult to see on the presentation. But all of the modules, all of the resources that are listed in this presentation are on this site. There's also the Spanish version, the HeloyaNM.com, Quit Now NM. So all of the resources are here, from data to I need materials for all of those different things. Okay. I'm going to go back to the presentation and head on over to this slide. All righty. So really looking at policies and partnerships as a contractor for for NUPAC, we recognize that, and especially health councils, you are all working in your communities, the boots on the ground. You know what your community needs, from a youth piece all the way to the higher level things and items in your community. So that stakeholder engagement and education is really important. There's a greater impact for your communities with boots on the ground. You know, I always consider myself like the trainer, come and bring the resources, but I'm not in the community. So as I work with the health councils to assess and identify the resources and tools and action plan that you need, again, it's integrating into the work that you're already doing. So looking at these policies, partnerships, and interventions, it really boils down to that community level, and then looking at how do we change the social norm and influences and behaviors. And it's, you know, really working with not just the health councils, but nonprofit organizations that help to make those changes. So looking at policy specifically and some updates. So the D. Johnson Clear Indoor Act has been updated, modernized to include e-cigarettes with broader definitions. Looking at the Tobacco Product Acts, you know, raising the minimum age to 21 years, requiring tobacco licensure, and then the holding tobacco manufacturers, distributors, and retailers accountable for the impact, the negative impact on health that tobacco and nicotine have. And then one of the programs that I didn't highlight on the website is the 24/7 Tobacco-Free School Districts program. So what you see here, with the exception of Cottonwood Classical Preparatory, are the school districts that have signed on to be tobacco-free. So they've gone through the training, they've made the commitment, and they are communicating that throughout the schools in their district. Looking at policy again from a housing standpoint. So a couple of things. So a lot of times we're talking multi-unit housing, basically apartments. And there is another contractor that specifically focuses on the multi-unit housing. But one of the things that I wanted to highlight in this specifically is the Mortgage Finance Authority. So for individuals who are looking to secure a loan to purchase a house, if you are a non-smoker, it's to your benefit. From a cost standpoint. So there's the mortgage points. And so that, you know, housing right now is all over the place, but for individuals looking to buy a home, it costs you less to be smoke-free. Looking at the casinos, this link highlights 7 casinos across the state who've committed to going smoke-free. Looking at the list of overall casinos across the state, that's about 1/3 of the casinos. So there's still some work that needs to happen currently because of COVID. There are a number of casinos that are closed, cars, and just individuals who have made the commitment to have smoke-free homes and cars. Now, this is relatively new, and I'm going to read through this because I think it's really important. The FDA in October permitted the marketing of e-cigarette products. This was directly towards current cigarette smokers, the first authorization of its kind by the FDA. This was a little bit of a shock, I think, to a lot of folks. The FDA also denies applications for flavored products for failing to demonstrate that marketing of these products would be appropriate for the protection of public health. The authorizations are an important step toward ensuring all new tobacco products undergo the FDA's robust scientific pre-market evaluation, said Mitch Zeller, director of the FDA's Center for Tobacco Products. The FDA will monitor the marketing of the products, including whether the company fails to comply with any regulation requirements or if credible evidence emerges of significant use by individuals who did not previously use a tobacco product, including youth. The FDA will take action as appropriate, including withdrawing the authorization. So that's, to me, just a bunch of legalese and gobbledygook. So some concerns here. Denials of certain flavors are promising, but there wasn't any news on menthol, which is a concern. I'm not going to go through all of these. The decision doesn't address nicotine levels. A lot of the e-cigarettes, we just don't know really what's in it. There's just a lot of things happening. They're still waiting decisions on the most popular e-cigarettes, which still young people are drawn to. And then looking at reimagining and carefully regulating the harm reduction approach. So there's a lot of concerns, and this was specifically for the Vuse Solo, which is part of, I believe, the Marlboro Company. So a lot of things happening on the policy side. It'll be interesting to see what the FDA, how this goes moving forward. So that's one thing that everyone is watching really closely. So partnerships, again, so much of the work that you do, that Constellation does, that NUPAC does, it's all about partnerships and collaborations. And so in this effort, it's really critical as we keep tobacco issues before the public. We're constantly fighting the tobacco industry, enhancing community involvement and promote community buy-in and support. That's where a lot of the work that you do comes in, educating policymakers and help to inform policy change. So all of these fall under that. One of the partners with NUPAC is the NMACT, the New Mexico Allied Council on Tobacco, and they hold a conference annually that around various key areas that address some of those items. And then this is that community engagement process. So really just the presentation, individual health councils who are interested in additional resources, going through that assessment and action plan to support the work that you're doing. That's what I'm here for, and to help you get going. And that's basically the heart of what we're doing this upcoming year. Oh, I did great. I went through that so fast. I always just think your time is so valuable and the work that you do is so valuable. As we're looking at nicotine cessation and prevention, the stats are really staggering. You can take a look at that on the NUPAC website.
And I did post some of those resources and the website link in the chat as well. And it looks like we have Rufus who may have a question.
Hi, Krista. I was just curious why TUPAC changed their name. I was with TUPAC for 11 years, and all the material that you just went over and everything are things that have been stable goals and objectives of TUPAC. And one of the things with the name TUPAC has always been it's solidified in the community. So people know TUPAC. And when you say NUPAC, where is the T in it? It's tobacco. When we were at TUPAC, I know we were, one of our things were the social determinants of health. That's what we were one of the first, organizations from the state that got involved in social determinants of health, where we work with legislators and alike, and also, in the community and everything. So I was just curious, why did they change the name to NUPAC to cause some confusion and then have the same mission and objectives and goals that they've always had?
Thank you for that. That's an excellent question. So I think the goal,
And I'm sorry, one other thing too. What does NEWPAC stand for now?
so NEWPAC is nicotine use and prevention. So it's the shift from tobacco to nicotine.
Okay. So that's to incorporate the e-cigarettes.
Yes.
Okay.
And recognizing, I think that for a number of just, individuals, when you, and this is, I think, because when we were making the shift, it really happened this fall, and it's still not completely shifted over. But recognizing that in conversation with organizations and community leaders that Constellation has had, to the tobacco piece, in their minds, normally they automatically will go to chewing tobacco or cigarettes, to the traditional cigarette, where nicotine encompasses more of what's happening across New Mexico and across the state. So including the traditional, chew tobacco and a traditional cigarette, now incorporating e-cigs and, vaping and all of those other pieces. So that was the focus of the change. And it definitely is confusing. I'm still not used to making that shift completely. It's just,
I mean, because they've standardized the name TUPAC as far as being, involved in tobacco control, social determinants, racism, anti-racism activities, and everything, training. And, to take away that TUPAC name like that, and then have the same objectives and goals, it just, I don't know, I just felt like, that name TUPAC, or that acronym TUPAC, has always been, a go-to where people, recognize it right away.
that's good to know. If it's okay with you, I'd like to share that with the team at NEWPAC, TUPAC.
Yeah, I know the team is different now and everything, because I left there going on 6 years ago now, but I know it's different. But I think that I don't know. To me, you got something that's already branded, and you're still doing the same objectives and goals, and that we were doing before. That encompassed nicotine and everything, and encompassed all the social justice work that we were doing and everything. That it does make sense to change to a new name, confusing people.
That's good to know. Thank you for sharing that. I appreciate it.
Thank you, Rufus. Is there anyone else who have maybe any other questions or comments for Krista? Let's see. Oh, Christopher.
Hi, everyone. I just had a question. I was just going over the presentation, and really well done. Thank you, Krista. I really appreciate it. But my question is just kind of maybe around what the program itself is doing around maybe harm reduction, and really working with people who are smokers and chronic smokers about why they're smoking, getting at the root of, the stress of why they're addicted to that too as well. I know with the coaching and the lozenges, those do help. But I think sometimes when we're really trying to get at behavioral change, but really not working with the person or meeting the communities where they're at for those smokers sometimes. So maybe like somehow addressing that in the program would be nice, or offering that as well too, because I see from the coaching services those are there, but there's nothing mentioned about like therapy and things like that, of like really getting at it, because eventually with those things that are hard to quit, I think that is always something that comes to mind.
Right. And one of the arms that we're working with is around behavioral health specialists who are working specifically with individuals. But what it sounds like you're saying is with harm reduction, I think we need to look at broadening those resources. And so let me find that out for you. And if you wouldn't mind putting your contact information in the chat, and I'll grab that and I can connect with you offline on that, because I think that's a really important question. Great, thank you.
Thank you, Christopher. Any other questions, comments?
Ah,
Oh, thank you, Holly. So I got your chat about highly recommending the training modules, free and available to everyone. So that is in the chat, and looks like Rufus's hand came back up.
My big mouth is here again. Hey, I just wanted to say, Krista, thank you. You know, it was a good presentation. I wasn't criticizing it. I was just like, standing up for the two-pack name, the brand, let's just say, that, I feel that, it's an important brand and it should be recognized, it can remain as two-pack.
yeah, no, absolutely. I didn't take offense at all. I thought it was a very thoughtful question, and especially because you've worked in this space for a while. I just really appreciate and respect your feedback. So no, thank you for bringing it up. I appreciate it.
Krista, I have a question, and I'm when you talk about policy and the licenses for tobacco outlets, is there any work happening with because you correct me if I'm wrong, but there is no density laws with tobacco like there is with alcohol. So I'm just curious if any work is happening with that.
That's a great question. I don't know that answer, but I will see if I can find that out for you.
All right, great, thank you. All right, any other comments, questions, going once, twice? Yes, and we will make the information available. Normally we send out follow-up emails with all of our presenters' contact information and if slides, if we can share, and some of the resources that they provided. So we will be sure to share that with everyone after we get done here. Hopefully, I'll get in contact with Madeline and we'll set a time to get that sent out.
Perfect. And if there is a health council who wants to go through that planning community process, just email me. We can get that scheduled and coordinated for you. And there are a number of health councils who've already signed up, so thank you for that.
Okay, well, I'll say a quick thank you to our presenters, and then we'll do a little closing. I'm going to give some updates for some of our health councils who are on the call. So thank you, Mary and Krista, for joining us today. We're always so thrilled to have presenters and resources and being able to share that information and disseminate that as much as we can. So I will share your information and some of the resources that you shared. So I will do a quick screen share here. And we'll just do a little bit of update. So some updates here coming up. Coming up on February 1st, we do have Public Health Day. And our theme this year is Racism is a Public Health Crisis. And I could share the flyer in the chat and also to register. We could put that in the link here as well. So let me do a quick. Okay, does anyone see the new link that I pulled up here? It says Public Health Day.
Yes.
Okay, sorry. So I'll just kind of
Looks good.
Thank you. So it's our 8th annual Public Health Day at the New Mexico Legislature. Racism is a public health crisis moving towards equity. We just wanted to share this information and this flyer. We have been sending it out weekly through announcements. So it is February 1st on a Tuesday, and we'll be having 11:45 a.m. to 1:15 designated to a public health showcase. So we'll be featuring some of our statewide public health organizations who are doing work around racial equity and racism. And so that'll be the first part of our Public Health Day. And then we'll have some featured talks from Dr. Davis Grace and Dr. Lara Parahan from Department of Health. And then we will also have some speakers, Dr. Tracy Collins from Dean of UNM College of Population Health, Denise Herrera from ConAma Health Foundation, and then also the New Mexico Alliance of Health Councils, as well as New Mexico Public Health Association. So we're pretty excited about that, and we'll be doing some breakout sessions. You'll get to choose, to learn a little bit more about certain organizations and the type of work that's happening in at a statewide level. And then there is an additional workshop, so that's from 2 to 3 p.m. And it's a workshop. It's going to be hosted by Sheena Talman. So she is the NMPHA racial equity consultant, and she'll be giving a workshop on principles of meaningful land acknowledgements for non-native led organizations. And we're happy to share this information with you all, but we have been sending it out in announcements as well. And then also just coming up, we do have our CDC Health Equity Committee community rebuilding trainings. Our next topic is going to be around the health equity committees and health council deliverables by tiers. And just a reminder, capacity self-assessments are due. We have sent out the links. They'll be due in February. And the link and the fact sheets have been sent out by email. So if you need follow-up, Susie, Madeline, or myself are happy to do that. And our next Health Council talk will be February 18th. So we do have a presenter already, and it'll be Wendy Wintermute talking about Share New Mexico and the range of information and resources available to you. So next month, we'll be learning how you can share what matters to you. So those are all the announcements I have. I'm not sure if Sharon or Madeline have any additional announcements or updates.
No, just what a great program today. And we are so excited to partner with the Public Health Association. They're a natural partner to health councils, and we love to find partners to collaborate with. So if you think partnering with health councils throughout the state can benefit your work in any way, please contact us. Our website is nmhealthcouncils.org, and there's a form you can fill out and just offer, could we work together? And we would love to talk to you.
Okay, well, if we're all good to go, and thank you to our presenters again, and thank you for everyone who joined us today. Shelley, did you want to say something?
Well, first, I just want to second what Sharon said. You guys are awesome. Health councils, the Alliance are just awesome partners. Thank you so much. And then I also did want to just share that the State Health Equity Committee is meeting today at 1 o'clock. I think most folks know about it, but they might want to jump on that link, and just really look forward to seeing everyone at Public Health Day. Thank you for hosting. Instead of NMPHA Fridays, right? Third Friday, we are going to Health Talks. So thank you.
Thank you so much, everyone, and have a wonderful weekend.
Bye.
Bye.